Welcome everyone to Just What the Doctors Ordered. My name is Dr. Tim Gant, licensed clinical mental health counselor, master addiction specialist, and certified rehabilitation counselor. And again, I am here with the
Dr. April Gant, DMP, family nurse practitioner, board certified.
That's right. Listen, guys, today we have a special topic that we want to discuss. And so let's get right into it. Let's kick things off. Dr. A, listen,
What?
I've been hearing a lot about, or getting a lot of people ask me questions about testosterone.
Okay.
And the impact that it has. And I think that there's some misconceptions when you think in terms of testosterone injections, low testosterone, all these things. So I wanted to kick things right off by asking, what is testosterone and what is it used for?
Testosterone is a hormone, and it is a male hormone that our body produces. It usually surges when we're in puberty, and then as we get older, it actually starts to go down. It regulates a lot of different things that's in our body. It helps people feel different ways. You can tell when it's low, and you can tell when you have the right amount. And usually people are seeking testosterone because they feel like their testosterone is low. They're showing some type of sign or symptom.
Well, I'll go directly into the male aspect of it because, males, they hate talking about this testosterone things, especially when they get older, because they feel like it kind of, and I don't want to say it messes with your masculinity. However, again, that's some of the things that they think about. So
Yes.
what happens when your testosterone level is low?
Well, some of the things that people experience are going to be things like fatigue. They have mood changes. Some people have hot flashes. And of course, one of the big ones is erectile dysfunction. That's one of the things they definitely are very concerned about. They will feel like they're working out a lot, but their muscle mass is not as, they feel like they're just not getting muscle as fast as they should. And sometimes you do have problems with bone loss.
So I'd hate to feel like if you are having any type of mood disorders or if you're feeling sluggish, it's going more into the art of my testosterone level is low.
Yes. Well, you're asking me that question?
Yeah, I'm asking because I need to know. The thing is, you're mentioning all these topics and you're scaring me a little bit.
Well, no. Okay. Well, if you ever do feel like that's what's going on, what we do, first of all, we ask you some of those kind of things because people do come in saying they're fatigued. And one of the things we do for males is we will draw their testosterone levels. We do it for females also. But that's one of the things that we do is we will actually obtain some labs, get a specimen, and we'll see, exactly what are your levels. Are they low? So we kind of look at that.
So when you look at those things, and you mentioned females as well. Do they have the same symptoms as males? Feeling fatigue, their mood changes. What happens in that?
Same symptoms. And you know how women are, our hormones definitely regulate a lot with us. We actually also start to have like our menstrual cycle the flow may get heavier, or either, we start to not have a flow at all. So that was just some of the things that the woman would have that's different from the male. However, the same thing with the mood, with the fatigue. Sometimes females start to grow a beard, things like that. So they want to know like what's going on. So of course we'll check the testosterone. That's one of the hormones. It's a few hormones, but that's one of the hormones that we would check for females also.
So men, can men start doing this when their female counterparts start to feel as if they're having some mood disorders, or if they start to act a little irritable? Can we say your testosterone level is low?
We can, how men always saying that it's the woman's hormone, that we can say that about you guys too. The man, you're having some hormones fluctuating. Same thing with the women. So it's women or men.
Okay. You mentioned some hair growth. Is that because there's too much testosterone, or is it the right level?
That is, for a woman, it would be too much testosterone. So they don't want the hair growth.
Well, are there situations where they do want it?
Well, I do, of course, if a a woman is trying to transition, if she's going through a transition, then she may want, or she wants to be like a he, so they want the beard, they want the mustache.
All right, what are some other things? Well, let's speak in terms of a female that wants to kind of transition over to a male. What are some benefits to that experience?
They will actually start to grow the mustache. They will actually start to grow the beard. They'll get a little more muscle mass. Their breasts will shrink, and their voice start to change, and they really like that because their voice starts to change and it gets a deep voice.
Are there side effects that they have to be aware of? And I know that with anything there are, but are there some that just stand out?
Yeah, well, one of the biggest ones that stands out, and we just kind of keep an eye on it, and I know everybody always talks about it, it's the cancer. Everybody's always scared of cancer because cancer is a type of hormone. So, of course, if you're given a hormone, we always worry about that. And the main one is that prostate cancer. I know most urologists, they always are against the testosterone because of, due to prostate cancer.
That's interesting to know because a lot of times when men feel like their testosterone levels have lowered, the big thing is they want to do something to kind of elevate that, but being aware that, that is out there, prostate cancer and any type of, and other cancers that, they have to be aware of. So it's good information to share that. For males, what are some of the things that are very beneficial for them to, elevate those testosterone levels?
The males, they start to feel better. They get energy. You can tell when they've been working out. The muscle mass starts to build. The males really, of course, it helps with the erectile dysfunction. So they really like that because it helps with the sexual function that they may be experiencing. So those are some of the things that the males come in for, and they will actually come in weekly to get these testosterones because they do not want these things to change.
Not that I'm familiar with this, but does the levels impact the skin? Does your skin start to look a little more rich, or tell me a little bit about that.
The testosterone is a hormone that actually will make the skin look. Now, if it's too much testosterone, you can get acne, but if it's the right amount of testosterone, yes, your skin will be pretty bright and it will be clear. But if you start to get too much, you may start to experience acne.
Can you experience acne? Because again, a lot of times not that they're in the same line, but steroids and testosterone, men started to get kind of like acne on their back area, the back region. So,
that's one of the things, like if a male is getting too much testosterone, he could get that acne.
In different areas?
Back acne, face acne. Yes.
Okay, very nice. Is there any potential outside of the cancers that we talked about? Are there any other potential things that men should be aware of whenever they're boosting those testosterone levels?
Just be aware of the mood. I know a lot of people say that you can get into a good mood, but if it starts to go too high, they say that they will start to get aggressive. So just notice those kind of things, because if a person is getting aggressive, or if we're starting to see some type of mood disorder that's not normal, we will look at those testosterone levels again. And if we feel like we need to reduce them or stop it for a little while, we will, based on the mood, because we don't want you out being angry because you're taking too much testosterone.
Is it a problem mixing testosterone with, and this is more for the people that go to the gym on a regular basis, especially males, is it a problem with mixing things like amino acids, testosterone? You're mixing a lot of different substances because, again, you're trying to boost that adrenaline. You're trying to boost being able to lift as much as you can. Can you run into any issues when you're doing that?
You definitely could run into issues when you start to mix medications and the different things, because they are affecting those hormones, and you want to always be careful with those hormones, because remember, your thyroid is a hormone. We have a lot of things in our bodies that the hormones are regulating, and so you want to be really careful with that.
Are there certain levels that a person should be looking at when we talk about testosterone, when you go in and you do your checks for them?
Yes, we do our testosterone levels. We have the low and we have the high. So whenever a person's testosterone is not within the normal and it's low, we will suggest the testosterone, especially if that's something they're wanting. But once it gets really high, we will also let them know that, okay, we got your testosterone high where it needs to be, so let's kind of come off of it a little bit.
Is there a time frame on that? Does that normally last? Let's say, for instance, a person comes in, their levels are not too low, but they're low enough to start getting on the testosterone. How long do you perceive somebody staying on that?
That's a very good question. And what we usually do is we check every 3 months. So I kind of look to see if the testosterone is staying stable. Is it staying right in the middle? Is it going way too high? Because I'll take them off of it, but they'll come back in a month or two and it has already come all the way back down again.
Do you check men more regularly than females, or females more regularly than men?
I check men more regularly than females. But females, I try not to forget, because it is definitely a hormone that I need to check in them too, because their hormone, they definitely have that hormone imbalance, and testosterone is one of the hormones.
Why do you check men more often than females? I mean,
because
what reason?
Testosterone is one of the male hormones that affects them more than the women.
Very, very nice. You know, you think of these things, and a lot of things that you've touched on, you lose focus on them. You lose sight that those are things that can be things that can impact a person. Again, when we think about testosterone, it's like erectile dysfunction. You start thinking about those things. But, when you talk about, cancers that might be associated with it, the acne that could come, with it. There are a lot of different things that people don't know about this that you need to know.
Yes.
Yeah, so.
It is. And the good thing about the testosterone, when people do want to try testosterone, I try to remind them it is a lot of different forms of testosterone. They have the pellets now. You can actually put a pellet, a little slit under the skin, put a pellet under the skin, and they can have a pellet. You can have the cream, the sublingual, the injections. So it's lots of different forms of testosterone now.
I'm one of my good friends, his father had started on the testosterone pellets, and I remember the first time he told me, and he's like, his dad felt so good.
Yeah.
But which one works the fastest, or is there, which one would you recommend?
Well, the one that's going to work the fastest is going to most likely be the injection, because I know that pellet is going to work, but it's supposed to go slow, because that's actually something that we're putting under the skin, so it's going to be working for a little while. So it's just releasing small amounts of testosterone.
Is there a reason to do one over the other?
No, it's just that patient's preference.
Okay, good. So, wow. Pellets, injection, again.
Creams, like a lot of people don't like shots, so they'll say, give me the cream.
Yeah, so, oh man, nice. So the cream, how impactful or how effective is the cream?
It's very good, because it's absorbed through the skin, so it's absorbing and it's doing what it needs to do also. It's just a different form of the way the body is taking it in.
When we think about sports and we think about athletes and doping, and testosterone. Tell me a little bit about that, because we've experienced that so often in sports. Are there levels? Do you think these athletes that are performing at a high rate, are these athletes that have too much testosterone in them?
Well, like I said, it is a hormone, so testosterone can be a part of those hormone injections that people take as for enhancements whenever they are trying to do sports. That's what makes them stronger and bigger and faster. Like I said, that hormone is an enhancement drug, so it does enhance what a person is trying to do.
Are these things that would, when you look at that, are these, if you had an athlete that had too much testosterone in them, would this be something that would create concerns for, people that are looking at them, or would this be banned?
Well, if you're in a competition and you're on those enhancements drugs, another person may not be on the enhancements drugs. So it's kind of like not fair. You're on the testosterone, the hormone, or the enhancement drug, but another person is doing it more naturally and organically. So I would just say that if you're in a competition, it just wouldn't be a fair competition.
This is kind of, I don't know if you'd be able to answer this, but because we're on that line, there was a company that, and I won't mention that on this podcast, but there was a company that actually was able to kind of camouflage what was actually going into the system.
Yes.
Is there a possibility that an individual will have testosterone levels at a high rate, but you won't be able to detect it?
I'm sure that people can mask that in different ways.
Yeah.
Yes.
Because again, that was what was going on in the sports world.
Yes.
Being able to mask those things.
You can mask it. You can mask it where you wouldn't know that's the particular drug that you're taking because someone didn't test for it. But if somebody figures out the test that needs to be tested, then that's how you'll get exposed.
What if I'm not a professional athlete and I just want to just perform, be really good at everything, and I start taking that? is there a window of time before it starts impacting and affecting me in a negative way?
Well, of course, once you stop taking it, you're going to go right back to your normal body because that's what it is, an enhancement drug. So once people are off of it, they go right back. They will shrink back to themselves.
So can I stay on it for a long duration of time?
You can stay on it as long as someone is monitoring you.
What if I don't have anybody monitoring me?
I
love the feeling.
Yeah.
I'm out here. Everybody loves the way I'm performing. Mm-hmm. I'm out here. I'm either running track, I'm playing ball, I'm doing something where I'm feeling good. Okay. And I'm like, I don't want that feeling to go away.
Okay, that is good. I want you to feel good also, but you just have to make sure you're being monitored.
Okay. Mm-hmm. Have you ever experienced individuals that had too high of a level,
yes,
and it was so bad that you had to immediately start to mm-hmm. bring that down? What are ways that you would bring that testosterone level down?
We just actually, I won't abruptly remove it because then the side effects may be even worse. So I actually really start to just wean them off of it, because I have had a person or had people that just get like really moody, really angry when that testosterone level is just way too high.
What are some of those side effects?
Just real angry, real moody, real irritable, not their normal. So we'll look at their levels to see what's going on, and most of the time we'll notice it was just like way too high, so we got to wean you back down.
Jittery, depression, things like that. Do you think that come with possible withdrawal symptoms of not having it, or the levels being too high?
People that actually come off of it or stop it, they'll tell me they're very fatigued. And if you're very fatigued and you're not as strong, you don't have that energy, then that's what will lead to that depression and feeling like you can't do anything. But it's that fatigue that where you used to have that energy, able to go, able to do, that excitement. But when that goes away, that fatigue, low, not able to do anything, I take them in a depression phase.
Yeah, and
take them.
And I've seen, and this may not have anything to do with testosterone, mm-hmm. but sometimes you go to the gym and these guys are amped up really high. Mm-hmm. They're really jittery. So you start to say to yourself, "Hey, with that, are their levels too high?"
So you're asking me, are their levels too high?
Yeah, do you feel like that? If they have those jitters, if they are starting to act out of character?
Yes, it could be. Yeah, it definitely could be. They will do those kind of things.
Are there specific age ranges that what age can you start with the testosterone?
I would say, because like I said, at puberty for a male, that's when or a female also, their hormones, that's when you have a spike. So you wouldn't need it then. So it's only once you start to get older, maybe 50 and above, that's when your testosterone levels are really low. When people just want it for the enhancement drug, you may start at 20s. You don't want them to. At 20s, 30s, they may come because they want that enhancement drug.
What about the females that want to kind of merge over into the male world? What is the age range that you would start that process?
That's a little different, and everybody is different, and it just depends on, just trying to meet the requirements and the FDA recommendations and things like that. So that would be different, and they would actually go to someone who is specializing and monitoring them as they're doing that transition. The main thing is being monitored, because you notice now people are trying to transition at a much younger age now. Yeah. So I've seen people transition at very young ages, but they have to have their parent to consent to that. So it's not even, the child can't even do it on their own. It has to be a parent that consents to a child being able to transition and be on hormone drugs at such a young age.
Wow. Again, this is very enlightening information. Definitely you have exposed me to a few things that I have probably just run across me that I hadn't been thinking about. Mm-hmm. So, it's good that we're bringing this topic up, because again, when you have individuals that ask questions, especially as you get older, yes. You have your friends that'll come and say, "Hey, I had this issue here. Can you help me out with it?" So it's always beneficial to be able to give them information in mm-hmm. regards to this. So I guess that's why it's a hot topic now, because I've had several friends that have asked questions about that as of recent. So that's real important. So listen.
I can say that the patients that do come here for their testosterone injections, they feel great. They feel wonderful. I make sure I monitor them, make sure they are safe, And as long as we do that, they can be very productive whenever they are on those injections.
So we had a couple of questions, and a lot of these questions that were, people that were asking, we've kind of answered them. So I'm just going to go and try to find one.
Okay.
We had, someone put out a question, and they asked, what are the potential risks and side effects of the testosterone injections?
And like I said, one of the main ones is that prostate. Everybody worries about the prostate cancer. And some more risks could be the mood was one of those big ones. If you had, just making sure that we keep an eye on that mood and the energy levels.
Yeah. Another great question that came up, and I don't know if we hit on this enough, so I think this would be good to answer. What should someone consider before deciding to start testosterone injection therapy?
I would definitely take a full panel of everything to make sure everything is okay. Make sure your heart, liver, just make sure all your organs are okay, and make sure that the testosterone is really low if you're getting it, because you want to increase that testosterone. So I would definitely want to know the baseline of the testosterone levels.
All right, very good. And I'll ask you one more. I mean, we had a lot. When we started talking about this whole testosterone thing, a lot of people were coming out asking a lot of questions, and I thought that was really cool that people wanted to know more about this. So last question for you. Are there any long-term studies on the safety and effects of testosterone replacement therapy?
There are lots of studies on all of these things because it is something that had to be FDA approved. So yes, lots of scientific studies have been done on testosterone and getting those injections that we do need to follow.
Well, listen, a lot of good information on this one. I mean, a lot of stuff that from the male perspective we can take in, and even from the female perspective we can take in, and it can kind of help us out. So, a lot of what you hear when you think of testosterone and when you think of the things that we do, they go by us, and we don't really pay much attention to them. So it's good that you talk about, really, really important. I like when you touched on the injection, the gel, and then also the pellets. I really like that. I can guarantee you there's some individuals out there that didn't know there were some pellets.
Yeah, some pellets.
Yeah, so.
But a lot of people love that cream and that gel.
Yeah, so, last question for me. When you're on the testosterone shot, injection, or whatever it may be, does it suppress your appetite? Does it impact the way you're eating, in that area?
It could suppress. It could actually enhance your appetite, but most of the time people are trying to get more muscle mass, so they know that we need to eat, the right proteins and the different things because they're trying to build that muscle mass. But it definitely can increase the appetite.
Okay, increasing it, does that? With that testosterone in you, does it are you, if you're eating more, and even if it's not healthy eating, are you putting more weight, or
You can put on more weight. That's why when you're on those, we do want you to kind of work out, because that's what it will help with the muscle mass, because you always want more muscle mass than visceral fat.
Oh, very nice. Listen, guys, you have gotten some great information today from none other than Dr. A. Listen, she has informed us. She's been able to give us great information and insight on some of the things as it relates to testosterone. Some of the things that from a male perspective, I hate to say it, but I didn't even know. So, again, you're always learning something, and it's always good to put yourself in a situation where you have the possibilities to learn new things. So, I really appreciate this discussion. I really think that our audience and our listeners are going to really appreciate it as well, because, again, it has been very, very informative. Listen, Dr. A, like always, I have really thoroughly enjoyed this.
Yes.
I got to go and make sure my mood level is right.
Okay.
Got to make sure that all my stuff is right, because, maybe I need to go get my labs checked. I've been feeling good, though. Feeling real good, so I don't think I'm okay right now. I'm getting older, though.
Because, like I said, once you start to get older, which, you are,
Easy.
Once you start to get older, that will start to come down. But the thing is, I think you're doing good. If you continue to eat healthy and do some of the right things, you wouldn't even know. Like if you're eating healthy, drinking water, exercising.
I was going to say water. How does that go along with it? Water goes with everything, but what's the importance of water drinking with testosterone?
Drinking plenty of water is really going to be good. taking too much testosterone sometimes may retain the fluid. So that's another reason that we kind of keep an eye on that also.
Hey, listen, we can go on for days, and I guarantee she can give us great insight and information on this stuff. So listen, again, really, really appreciate you, Dr. A, being able to sit down and give the listeners a good dose of testosterone, the impact it has on you and your body from a male and female perspective. So again, really, really appreciate that. Listen, guys, this is just what the doctor's ordered, and this is what we do. We give you good information. And hopefully this is information you can take and utilize in your day-to-day. So again, from Dr. T, Dr. A, you know where to find us on any of our social media platforms. Give them some, Dr. A.
A brighterfutureinc.com or 1521 Owen Park Lane in Fayetteville, North Carolina.
That's right. And you can find us on Facebook, TikTok, Instagram, Twitter, you name it.
And if you have any other questions about this, just reach out to me and I'll be glad to answer questions.
Reach out, guys. Don't hesitate to do it. Listen, this is just what the doctor's order, and we are